So this is Dr. Amit Bhandarkar from Spine Center Chesterfield. We are blessed to have Dr. Satyajit Marawar here, who practices in Flint, Michigan, who is visiting us today here at St. Louis. And he brings to us tremendous amount of insight that he have gathered since last 15 years of his practice in spine surgery. I've known him for a long time. He has been my mentor in many ways. And we have been discussing about a lot of relevant topics in spine surgery. And we just thought maybe we should record it. It kind of helps all young aspiring spine surgeons about the common topics. The debates are always about the common topics. Also, we have witnessed the transition of spine surgery, right from open surgery to minimally invasive surgery, now to endoscopic surgery, now to even pain surgery. So we're going to talk about these topics and what are the factors influence this transition, and what do you see in the future, what are practical tips about some of the procedures, what he has integrated into his practice, what he plans to do in the future to further kind of serve the increasing tide of patients which has been kind of showing up to our doorsteps for the pain and for the problems with their spine. So I think let's first start with the question. Tell me a little bit about your practice, Dr. Satyajit, and tell me also give a context where you come from.
So this is very interesting for me, and I love spending time with Dr. Bhandarkar. We have grown up in the world of spine surgery together, and in many ways have learned from each other over many years. But I think it's an excellent idea to record this conversation to try and sort of put things into perspective. I've been doing only orthopedic spine surgery for 15 plus years, and it's an evolving field of surgery, which is what is attractive about spine surgery. It's not static. It never was static, and it never will be static. And the discussion now in spine surgery is very much focused on reducing trauma associated with doing spine surgery, which leads to not just a lot of pain. It also leads to longer recovery, increasing risk of complications, and that's now more of a focus than it was 15 years ago because of aging of our population. And both of us are very much interested in minimally invasive surgery and endoscopic spine surgery. And I think one of the things I really like about Dr. Bhandarkar is his focus on endoscopic spine surgery. And what I want to ask you today is that in the last, say, 10, 12 years, you must have seen how endoscopic spine surgery has transitioned from the point where it was on the periphery of spine surgery and not a whole lot of surgeons interested in it, not a whole lot of surgeons practicing it, not a whole lot of insurance reimbursement for it, to a point where now it's a topic of conversation in almost every conference and a lot of surgeons trying to get into it. Why do you think that transition happened?
Great question. So I have witnessed that transition. So a lot of people become endo-curious. All the surgeons like new tools and want to adopt new techniques, and a lot of people were endo-curious, but there are a lot of hindrances to adoption, reimbursements, training, steep learning curve, reorientation of the anatomy, and then extra overheads as people try to do those surgeries. So again, it's been long struggle. Endoscopic spine surgery is not new. It has been there for a long period of time. So what I see is there are two factors. There is a natural progression of a surgeon's desire to do minimal trauma. As a surgeon comes into practice, tries to analyze his own results with open surgery, he quickly realizes that there should be a better way to do this. accomplish the same goal with minimizing trauma to the patient. And that's where patient who started with open surgery slowly understood the benefits of minimally invasive spine surgery. Like initially, patient would go ahead and be admitted in the hospital for single level fusion for up to 5 days.
Yeah.
And nowadays, all the patients go maybe next day. Still on some of the Medicare admission only list, but things have changed. They have seen that transition. Now that desire to again do better than what they can do in minimally invasive spine surgery was there. And they became endo-curious and they saw that none of these patients even can be sent home on the same day. There's further minimalization of trauma. There is better visualization. There also has been tremendous increase in the knowledge of the microanatomy. People usually used to go by macroanatomy. I used to call them X-ray anatomy. Right now, they are now talking about microanatomy. Like they're talking about mammillary accessory notch, as we talked about in the morning. They talk about Campine's triangle, which is a smaller part of things. But now everybody wants to put it in a lens and see it. Oh, that small corridor suddenly start appearing pretty big. So there has been, again, the desire was there, and the desire, has progressed quite a bit because they've seen the results of minimally invasive spine surgery. And after that, there was a huge revolution, I say, in spine instrumentation, spine implants. We can see better now with a better illumination, better magnification, better scopes which are available today. And now there with the endo-curious people, with the industry coming together on this, has put up a lot of training sessions, and now people are now trying to get their hands on this new technology. And some of the people who are early adopters are being able to show the result which everybody dreamt of doing, and that has made a lot of people transition from being endo-curious to practicing endoscopic spine surgery. The possibilities have not been met yet, so we all want to progress, we all want to do better for a patient, and that is the new frontier.
Yeah.
And that is why it is the topic of discussion everywhere. So if I want to have a surgery on any of my family member, you will not be able to convince me for doing a open surgery on them or MIS surgery on them. I will do an endoscopic spine surgery on them. Because once you do that, and once you see the results coming out from patient, it is difficult to go back.
Yeah, Matt, I think the one thing I would add to that is that with technology advancing in every other aspect of life, there is also expectation from the patient community that the surgery that they are going to get matches somewhat with the technology that they experience in other aspects of their life. And spine surgery to some extent has been lagging behind in progress on that front, and I think endoscopic spine surgery is the way forward in sense that the technology that it offers will be a giant leap. Before that, whatever progress was there in spine surgery was very much incremental. But endoscopic spine surgery, in my opinion, is not part of that incremental ladder in spine surgery. It's a separate ladder. It's a giant leap to where surgeries that require longer incisions, muscle damage, blood loss, pain, recovery now can be done in much smaller incisions, hardly any blood loss, hardly any muscular injury, and can be done at an outpatient surgery center without exposing patients to hospitals, which, as everyone knows, that they, hospital admissions carry their own risks. With patients having endoscopic spine surgery in surgery centers, the experience is much better. Risk of complications is lower, risk of infection is lower. They go home the same day, and more often than not, when you call them the next day, you end up with a very happy patient trying to get back to his own life almost right away. It's like
turning on the switch.
Yeah, I mean, I'll tell you what, I was talking to one of my general surgery friends, and I was talking to them about robotic surgery, which is a lot more common in general surgery than it's in spine surgery. And I asked him, how do you explain robotic surgery to a patient? And this is what he said. He said, if I'm doing robotic hernia surgery on a patient, I tell them that it's going to be like a blip in your day. You'll come in, you'll have the surgery, you'll go home, it will be like a blip in your day. And I realized that I've never used that word when explaining spine surgery. I've always tried to tell them, okay, this is a big deal, this is going to have implications for the rest of their life. Recovery is going to be weeks, because that's how we were trained. That's how spine surgery used to be when we trained. But when I explain endoscopic surgery, I can use that terminology.
Right.
This is going to be like a blip in your day. You'll come in, you'll have the surgery, you'll go home. The wound is as much as a quarter. And, so that's why I feel that it's not on that same incremental ladder of other technology that was used in spine surgery before endoscopic surgery came along.